Hi, welcome back to Fostering Resilience. If you're brand new to my channel and this is the very first time you're clicking on one of my videos, welcome. My name is KJ Foster. I'm a licensed therapist and I create videos that are all about addiction recovery and also general mental health issues. Lately, I've been creating meditation videos, although today's video is not a meditation video. It's all about post-acute withdrawal syndrome, but I did drop a link in the description to one of my meditation videos called the Peaceful Place Relaxation Meditation, because I think it's something that will help you with post-acute withdrawal. So if you'd like to check that out, the link is in the description. Also, if you haven't yet subscribed to my channel, if you click on the red subscribe now button, which is below, and then when the bell pops up, if you click on the bell, you'll be alerted to all of my upcoming videos, which I post every Monday. But like I said, today's video is all about post-acute withdrawals. It's an in-depth look at post-acute withdrawals, and I created this video specifically for one of my viewers who asked me for more in-depth information. So this video was created for and is dedicated to Ed. Thank you so much, Ed, for your support of my channel and for watching my videos, and especially for asking me for this information. And so I'm going to be covering information such as general symptoms, duration, recovery timeline. Those are some specifics that Ed asked for, but I'm also going to be covering triggers and, most importantly, ways in which you can move through, you or your loved one can move through post-acute withdrawals without relapsing. And so what I decided to do is I decided to just take the information that I share with individuals and family members in treatment and bring it to you and go through the same PowerPoint presentation. So this is, like I said, it is in-depth, and it's a little bit or a lot longer than the majority of my videos that I upload, but hopefully you'll find this information beneficial, and if you do, please share it with others who it may help. So let's go ahead and get right to the information. Okay, post-acute withdrawal. As you can see based upon this initial slide here, this information is not only information that I provide in treatment to individuals and their family members, but it's also a part of my Resilient Warrior Masterclass. If you're interested in getting some more information about that, you can go to drkjfoster.org. So this information is everything that you and your family really need to know about post-acute withdrawals. And what's interesting I have found about post-acute withdrawals is that there are so many people who have never heard of it, who don't know about it. And I'll get into why that is dangerous if you don't know about it, why it's so important to know about it. But just like everything else relative to addiction recovery, we don't know what we don't know until we know it. I mean, there was a time where I didn't know about post-acute withdrawals. So, I'm hoping that this is really going to be helpful for those of you who don't know about it or don't have very much information about it. Most people are familiar with acute withdrawal, right? So that's the phase that happens immediately from the moment, we stop putting the substance in our body, whatever that may be, whether it's alcohol, drugs, or a combination. Acute withdrawal occurs from the moment we stop consumption, and it can last anywhere from 4 to 10 days. And some people might say, maybe it would last 1 day or 2 days. It depends upon so many different factors. It depends upon your age. It depends upon the types of substances that you were using. It depends on how long you were using the substances for, the quantity of the substances. I always say that for anybody who is going through withdrawal, that they should always be medically monitored. And so whether that is in a detox facility or not, you need to be monitored by a physician, or monitored by someone, a physician, a nurse. When I've said, I recommend detox for everyone, I've gotten a lot of pushback on that, in that people say, well, I took benzos and I didn't, need to be in detox. Detox actually makes it worse. And, there's something to be said about that. Like, I'm not disagreeing. I'm not wholeheartedly agreeing, but I'm not disagreeing. But the bottom line is, I emphasize medically monitored, because there's, people could have a seizure. There's all sorts of things that can happen. And the most deaths, especially for alcoholism, that occur based upon the individual going through this acute withdrawal phase. So you have to be really careful. But here we go into post-acute withdrawal, which, like I said, a lot of people don't know about this phase. And I've actually heard people say, there was a class I was teaching once. I teach a master's level students occasionally at a local university. And when I was teaching them about substance abuse, one of my students said that she thought it was something that was made up by the insurance company. She didn't believe that it was a real thing, and that is just completely false. It's absolutely a real thing. And what it is it's a stage that happens after the acute phase, because your brain has been so impacted by the substances, and it takes a long time for your brain to fully heal. So what happens during this stage is that the brain chemistry is gradually returning to normal. And so as the brain improves, as the brain is healing, the level of brain chemicals will fluctuate, and they'll cause these symptoms to occur. And so what are these symptoms? These symptoms, the most common post-acute withdrawal symptoms, are mood swings, anxiety, irritability, tiredness, depression, low enthusiasm, cravings, variable energy, variable concentration, stress sensitivity, and disturbed sleep. And so under that variable concentration, I want to put cognition issues, because I can tell you that when I was going through post-acute withdrawal, I had significant cognitive issues that were going on. And the cognitive issues were things like memory. I couldn't remember certain people's names, and I would read a paragraph in a book and completely forget what I had read. There's lots of cognitive issues that come into play with post-acute withdrawals, again, depending upon the substances, quantity, duration, all of that. So these symptoms of post-acute withdrawals, in the beginning, the symptoms are going to change like minute to minute. And so when I say in the beginning, typically, and again, this is typically, you're going to hit, or your loved one will hit, the post-acute withdrawal stage about 14 days into detox. So like I said, acute detox is anywhere from 4 to 10 days. Regardless of how long that detox process happens, it's usually at day 14 that the post-acute withdrawals start to kick in. And so what can happen is that, say you detox for 5 days, right? And you're feeling better after those 5 days. You're gradually starting to feel better and better. And by day 10, by 11, by 12, you're feeling great. And you're like, I'm through the woods. I'm feeling good. You're positive and hopeful, and your energy is good. And then what can happen is you can just all of a sudden wake up one day and feel like you got hit by a truck. Just the negativity has come back, maybe even a little hopelessness, irritability, not being able to sleep, and you go, what the heck happened? I was feeling so great. But this is the typical cycle that will happen, is that you'll feel good, all of a sudden wake up, feel terrible. It'll last a couple of days. You'll go back to feeling good again, and then this, like I said, it's a cycle where it continues to happen. But what it means is there's good news. What it means is that your brain is healing. And so why this is happening is that the brain, the chemicals in your brain are healing, are equalizing, and then that's creating these symptoms. So in the beginning, the symptoms could potentially change minute to minute, hour to hour, over a period of a couple of days. Later, as recovery progresses, the symptoms will disappear for a few weeks or even months, only to return again. And as you continue to recover, the good stretches will get longer and longer. However, depending upon what your drug of choice had been, the bad periods of post-acute withdrawal can be just as intense and last just as long, again, depending upon type of drug, quantity, and duration. So I'm just trying to give you like a general picture of what it's like, but it is going to vary depending upon the drugs. That I can tell you that if you are somebody who used a lot of benzos, that benzos have a tendency to produce some significant post-acute withdrawal symptoms. So that's just something to keep in mind. And so why is this important to know? It's important to know because if you don't know to expect this and it happens, it really puts you at great risk for relapse because it does come out of the blue. There's no like obvious trigger for it. Generally, there's no obvious trigger. I mean, there are definitely things that you can do or not do that could make your symptoms worse. And so we'll talk about some of those. But generally speaking, I mean, you could just be moving about, your recovery, doing everything that you're supposed to do, and these kick in out of nowhere. So the good news is that each episode of PAWS, as it's typically referred to, usually lasts only for a few days, usually. So once you've been in recovery for a while, you're going to find that each post-acute withdrawal episode usually lasts for a few days, and that, like I said, there's no obvious trigger, and you'll just wake up and you'll feel irritable and won't have much energy. And so expect it, expect that this is going to happen. That's the biggest part of post-acute withdrawals is the awareness of that it's going to happen. And that if you hang in there, and recognize that it's going to let up after a couple of days, it's going to lift just as quickly as it started, usually, then after a while, you're going to start to develop more confidence that you can get through it. Because each time you get through it, you're going to get a little bit stronger. So the duration of post-acute withdrawals. Now, this is what some people, get a little nervous about. They go, oh my goodness, and that's the fact that post-acute withdrawal can come and go for up to 2 years. And, I would say that, again, depending upon the drugs that you had been using and the quantity and the duration, it could be longer than 2 years. But generally speaking, it's like 18 months to 2 years, and that's pretty much what it was for me. My post-acute withdrawals lasted about 18 months or so. And so this is, one of the most important aspects of PAWS for you and your loved ones to remember, because you can get through it and you will get through it. And you'll get through it more quickly if you know what to expect and you know what to do. But if you think that post-acute withdrawal will only last for a few months, then you're going to get caught off guard. And if you're someone who is the loved one, you're watching this because you have a loved one who is in recovery, then, obviously you're not responsible for your loved one using or relapsing, but you actually can contribute to their struggle without even knowing it, because not knowing about PAWS could actually be a risk to their recovery and to yours, because what can happen, and this, I experienced this with my son, because my son is also in recovery, and so my experience with him, I was already sober for, I was 14 months sober when he entered into recovery, and so his post-acute withdrawals, to me, they were a little scary because he would get irritable in ways in which it seemed like maybe he was using, and that's where family members can get thrown off, because the behavior can seem like your loved one might be using because of the mood swings. There's mood swings, there's irritability, they're not sleeping at night. So maybe you're like, they're up all night, what are they doing? And so it can create this fear that your loved one has maybe relapsed when they haven't. They're just going through this post-acute withdrawal stage. And this is where we can contribute by being nervous and fearful and then reacting toward them in a way that can make their post-acute withdrawal symptoms worse. So this next slide, I cover just the cycle of trigger and craving. So most triggers are for, relapse are emotional triggers. So we experience the emotional trigger, whatever that may be. Maybe the emotional trigger is stress from job, from family, any kind of relationship, or it could be the emotional trigger of just the uncomfortability of the post-acute withdrawal symptoms. And then those emotional triggers, they create a craving. And then the craving leads to a ritual, which leads to using, which leads to guilt, and then creates this whole cycle of relapse. So we want to get in between the emotional trigger and the craving that could potentially occur by doing things that help to move through those post-acute withdrawal symptoms so that you don't, or your loved one don't relapse. So I'm going to go through some of the triggers that are associated with different types of drugs, because I think that this can be helpful. And also, recognizing that some of these may overlap. They're not just specific to that particular drug, but they're generally, they're generally associated with that particular drug of choice. And you'll see what I mean as we move forward here. So let's look at alcohol. So some of the common triggers associated with alcohol are negative affective states, okay? So that emotional trigger, especially anger and depression. Discontinuation. I put here discontinuation of AA involvement because the treatment center where I conduct the family program is a 12-step based treatment program. Also, the counseling that I do involves a lot of 12-step facilitation, although I'm somebody that does absolutely believe that that's not the only way to recover. But let's just say discontinuation of any type of program involvement, okay? So whether that's AA, whether that's Smart Recovery, whether that's Celebrate Recovery, whether that's an IOP or an OP, whatever it is that you stop going, you discontinue your involvement. The social availability of alcohol can make it very difficult, can create triggers. Relationship disruptions is a big one, and that's why, generally speaking, we recommend for people who are single that you don't really get involved in a romantic relationship, which creates a lot of emotions in your first year of recovery until you're at a place where you're a lot stronger in your recovery. Because should something happen, should there be a disruption in that relationship, then that can be a significant trigger for relapse. Also, social issues like happy hour, airplane trips, holidays are a big one relative to alcohol. So watching out for those triggers, being prepared when you're going to be in a situation where those triggers are going to be involved, that you protect yourself to be able to move through those triggers. Okay, let's move on to marijuana. So if marijuana was primarily your drug of choice or involved in, combination with others, then some of the big triggers for marijuana are going to be anxiety, irritability, insomnia, friends that, still use marijuana, social situations, paraphernalia, liquor stores and head shops that sell, the paraphernalia, and concerts. Moving on to opiate and heroin, common triggers are stress, secondary use of alcohol or other drugs. This is where, a lot of people that I meet share with me that, drugs, like whether it's heroin or other or cocaine or whatever it is, like drugs were my problem. I never had a problem with alcohol. And so they'll use alcohol thinking that that's not their problem, and that can often lead back to what was their primary drug of choice. So secondary use of alcohol or other drugs can be a trigger for relapse. Analgesic use, basically medications, can lead to a relapse. Use of other medications, like when you go in for a surgery. I have a lot of friends who have to be especially careful when they go in. I just had someone who had a knee replacement surgery, and just the medication that is prescribed to get through that surgical procedure can put somebody at high risk for relapse. And then there's anhedonia. So if you don't know what anhedonia is, it means no feeling. So, opiates create an imbalance in our reward system, in our feelings, so that often, people will relapse because it takes a long time to go back to any sort of normal state of feeling joy relative to normal everyday activities. So that period where you're not feeling anything can be very frustrating and can lead to individuals relapsing simply because they want to feel something. So that is can be a high risk for relapse. Anxiety, depression, certain environmental cues, discontinuation of treatment, self-help groups, or medically assisted treatment such as naltrexone. Moving on to stimulants. Some major triggers for stimulant use can be alcohol use. So alcohol use, like I said before, with opiate and heroin use, can lead back to cocaine. Drug-using friends, environmental cues such as money, ATM machines, freeway exits, neighborhoods. Again, this is where we can, obviously cross over, and they can apply to any one of the different drugs of choice. There's also often a stimulus or sex connection associated with stimulants, and boredom, just being bored. And finally, prescription drugs. So with prescription drugs, such as benzos, there's going to be an extended withdrawal. So due to that extended withdrawal and the symptoms associated with that can lead to relapse. Insomnia, anxiety, panic, secondary alcohol use, just pain in general. Doctors' offices, pharmacies, and medicine cabinets can also be a trigger for relapse. Okay, so now that we know what the general symptoms are, what the duration is in general, and what some of the major triggers are for the different drugs of choice, let's look at how you can go about, or your loved one can go about, surviving post-acute withdrawals. So the first suggestion here is to be patient. To be patient with yourself, to be patient with your loved one. So your loved one, you can't hurry the recovery process, but you can get through it. And this is where the whole one day at a time thing is so essential. Not thinking, oh my gosh, I'm going to be going through this for 18 months. Oh my gosh, I'm going to be experiencing this for years. No, that doesn't mean that you're going to be experiencing post-acute withdrawal symptoms the entire time. I mean, you could go for months without experiencing them. It's recognizing that you can get through it. You're not necessarily going to have, I think the more that you fear it, the more you get anxious about it, the more difficult the post-acute withdrawal symptoms are going to be. That's why I suggest to people to embrace it, to lean into it, to think positively about it, because what it means when you're experiencing those symptoms is that your brain is healing. So that's good news. Like, it's good. So it's like, even though it's uncomfortable, trying to like think to yourself, well, okay, this kind of sucks, but it's also good because this means my brain is healing. And just taking it from that standpoint of one day at a time. And if you resent the post-acute withdrawal, like I said, if you look at it negatively, you or your loved one, you're going to become exhausted. And when you're exhausted, you're going to risk relapse. You're going to risk acting out in unhealthy ways. Post-acute withdrawal syndrome symptoms, like I said, are a sign that your brain is recovering. Next recommendation is to go with the flow. Withdrawal symptoms are uncomfortable, but like I said, the more you resent them, the worse they're going to feel. You're going to have good days and you're going to have bad days over the next 2 years if you're early on in your recovery process. So enjoy the good days. You'll also have bad days. On those days, don't try to do too much. Take care of yourself. Focus on your recovery and believe that you're going to get through it, that good days are to come. Next, practice self-care. Give yourself lots of little breaks over the next couple of years. Tell yourself that what you're doing is enough. Be good to yourself. Recovery is the opposite of addiction. And sometimes we can get caught up in this comparing ourselves to other people. Well, we get caught up in the shoulds. I should be further along in my recovery. I should be feeling this way. I should be doing this. And recovery is really like your full-time job for the next couple of years. It really has to be your main priority. And sometimes you're going to have, not a lot of energy or enthusiasm for anything. So understand this and don't overbook your life. Give yourself permission to focus on your recovery. And this is what's so important also for family members to understand, is that your loved one is not 100% when they leave treatment. Like it takes a long time to really feel 100% and to get back to that person, or even like become that person that you never were to begin with. But to get back to really being at 100% is going to take like a couple of years. It's not a quick process. So embracing that and understanding that and being gentle with yourself and your loved one. Because post-acute withdrawal can be a trigger for relapse. You or your loved one, they're going to go for weeks without any withdrawal symptoms, months without any withdrawal symptoms. And then one day they're going to wake up and PAWS is going to hit like a ton of bricks. They'll have slept badly. They'll be in a bad mood. Their energy will be low. And if they're not prepared for it, and if you're not prepared for it, it can lead to relapse. So being able to relax will help you through post-acute withdrawal. When you're tense, you tend to dwell on your symptoms and make them worse. Or maybe if you're the loved one, then you're dwelling on your loved one's symptoms. Don't dwell on them. When you're relaxed, it's easier to not get caught up in them. You aren't as triggered by the symptoms, which means that you're more likely to stay on track with your recovery. And remember that every relapse, no matter how small, undoes the gains that the brain has made during recovery. So granted, you're not going to lose the information, you're not going to lose all of the things that you've learned as a part of your recovery process, but you are absolutely going to lose the healing that has happened within your brain. So what follows are the best defense tips for post-acute withdrawals. Number 1 is meditation, which is exactly why I left you the link in the description to my Peaceful Place relaxation meditation, because it is one of the number 1 best defenses for post-acute withdrawal symptoms. So learning to take back control of our thinking is such a big part of successful recovery. So with some good direction, you can begin to calm your mind, and short periods of consistent meditation. Like just 2 minutes a day is going to be far more beneficial than longer sporadic meditation practice. Meditation is actually one of the most underrated and underutilized aspects of recovery. It is going to help you more than anything else. It's going to help you and your loved one move through post-acute withdrawal symptoms more than nearly anything else. And what's interesting is, like, I'll notice that people, it's very easy, to encourage and to get people who are in residential treatment to start to meditate, at least briefly for brief periods of time. And they'll do it consistently throughout treatment. But more commonly than not, people will leave treatment and they'll just stop. They won't do it. They'll just stop practicing. And like I said, it really is so helpful in moving through post-acute withdrawal symptoms that it absolutely is the number one recommendation. So number two is a regular sleep schedule. And some people might be like, oh, well, how can I have a regular sleep schedule if I can't even sleep? Because insomnia, difficulty sleeping, is one of the, main symptoms of post-acute withdrawal. But the point being with this regular sleep schedule is that the more consistent you can be with the time that you go to bed, the time that you wake up, not taking naps during the day, all those things are going to help you to move through post-acute withdrawal more easily, and it may even reduce your post-acute withdrawals. So the same thing with all of these defenses that I'm sharing with you, meditation, this one and all of the others, they're actually going to, if you practice these are going to minimize your post-acute withdrawal symptoms. So they'll help to not only help you move through them, but they'll help to reduce them as well. So the first element of this regular sleep schedule is diet. And because it's hard to sleep when you're hungry, so making sure that you're eating, and you're eating well, and that you're not, filling your body up with sugar and caffeine and all sorts of things that could potentially make your post-acute withdrawal symptoms worse. Nutrition is hugely important, and I have a video that I'm going to drop in the description as well that's all about nutrition and post-acute withdrawal. So the second element is like a target time. So it's setting up a window of time, say like 10 p.m. to 11, where you're going to start your bedtime routine. You're going to brush your teeth, floss your teeth, wash your face, thank your higher power, God, whatever, for another day sober, put the cell phone on silent, remove the distractions, and hopefully drift off to sleep. And the third element is a strict no napping policy. And obviously there are exceptions, like if you haven't slept all night the night before, then obviously, once you're able to sleep, you're going to take advantage of being able to sleep. But this is just, recognizing that you're napping during the day, it's going to make it much more difficult for you to sleep in the evening, especially if you're struggling with post-acute withdrawals. The next best defense is recovery friendships. So if you truly want to recover, you're going to have to shut the door on old friends that are a risk to your recovery. And so despite what you may think, I can almost guarantee you that you're going to have fun, okay? Because one of the things that I thought in early recovery was that, oh my gosh, I can't drink anymore. I'm never, ever gonna ever have fun. And that just is not the case at all. Recovery friendships add a layer of accountability to your program, and they provide you with people who you can go do fun things with, who you can confide in, and who you can lean on when you're going through post-acute withdrawals, because they've probably been through post-acute withdrawals themselves, and they can help direct you and support you. The next best defense for PAWS is exercise. Exercise is huge. It helps your body heal faster and actually shortens the time that you will experience post-acute withdrawals. So even something as simple as a 20-minute walk can do wonders for your mood based upon the natural endorphin rush that you experience as a result. And of course, as I mentioned, healthy diet, I would say healthy diet and exercise and meditation, oh my gosh, it's so hard to decide, but they're all so important. I mean, I was pumping my body with sugar and caffeine in early recovery, and as a result, my post-acute withdrawal symptoms were horrendous, and I believe that they lasted a lot longer than they would have had I been eating healthier during those, that first year and a half of recovery. And my rule of thumb about this is, okay, like if you're having a craving for alcohol or other drugs, and sugar or candy or some is going to help you to feel better, then have the sugar, like have it, definitely. But if you can avoid it, the more that you can eat healthy, the better off you're going to be with your post-acute withdrawal symptoms. And finally, the last best defense, the last on the list, is taking time for yourself. And if you're somebody who struggles with sloth, that's like, being a couch potato, then this is not necessarily the one for you. I mean, you can definitely be good to yourself in other ways, but this is based upon, like, I know for me, I could not be by myself for very long. I was just so uncomfortable in my own skin. I had to keep moving. I had to keep doing. I had to go. And I had this idea that even if I took like an hour or two to myself just to sit on the couch and watch TV, that I was being unproductive. And it's just not true. So taking time for yourself, being good to yourself. This is the whole idea of be gentle with yourself, be good to yourself. I share with people in treatment that the hospital analogy that, let's say we had a major illness, any other major illness, or for that matter, got into a major car wreck, right? So say you get into a major car crash, you go into the hospital, like any other treatment, whether it's addiction treatment or the hospital, they want you out as quickly as possible. So let's say, you're released from the hospital, but you're in a wheelchair, or you're released from the hospital and you have a cast on your leg or whatever. There's something that people can see that indicate that you're not well and that you're recovering. And, there's this process when you leave the hospital of healing where, you're gentle with yourself, and other people are gentle with you, and they help you with things. And that's just not the case with addiction recovery because you can't see it. And so family members especially have this mistaken belief that once their loved one gets out of treatment that they're good to go, that they can just jump right back into the job, they can jump right back into family responsibilities, and that's not the case at all. It's important to think of it like the person who's in a car crash that still has a cast, that may be even still in a wheelchair, and that there's this, recovery process that takes a long time. So being gentle with yourself, being gentle with your loved one, and, being compassionate towards yourself and your loved one. That doesn't mean that gives you the green light to just do nothing and use that as an excuse. But there has to be balance. There has to be this happy medium, because what happens too with some people is that they get so focused on their recovery process that they're constantly recovery, and they're not giving themselves enough time to just simply relax and be. So definitely take time for yourself, celebrate, your achievements, celebrate your 30 days, celebrate your 60 days, celebrate, as you continue to heal and reach these very important milestones of your recovery. So that is a wrap for today. Thank you so much for watching. I hope you found the video helpful. And if you did, and you know anybody who you think may also benefit from this video, please share it with them. And if you haven't already subscribed to my channel, please click the subscribe now button. And also, because you took the time to watch this entire video, I have a special gift for you. And that gift is a free relapse prevention ebook, which is in the description. There's a link. You can go ahead and click on that link and you can get that free ebook, which will help you even further to avoid relapse and to continue to be successful in your journey of recovery. So I hope you enjoy that, and I hope to see you back here next Monday. In the meantime, I wish you a very beautiful and a blessed week. Namaste.